Welcome back to Centerwell Senior Primary Care. We've been spending the morning here at the Clarksville, Indiana location, giving you an idea of what it's like when you visit here. We have stepped into the care team room. I'm with Dr. Misha Rhodes to kind of explain why this room is so significant and kind of the magic, if you will, to the whole approach to Centerwell.
Yes, thanks, Claudia. So this room is where the team meets in the morning to discuss the patients for the day. We have a huddle in the morning with everyone involved. And then throughout the day, the providers as well as the MAs are here to be able to work as a collaborative team to take care of our patients and meet their needs.
We've talked so much today about holistic approach, that being the key to everything here at Centerwell. How does that really kind of truly come together in this room and throughout everything you all do here?
When I think of the holistic approach that we have at Centerwell, it's about taking care of the whole person, not just their chronic conditions, but other things outside of that affect your health, like transportation or food insecurities. And so in this room is where we have those discussions between the team.
And talk about the location in each of the centers. Like the care team room is very specifically located in every location.
Yes, every location will have a care team room, and it is literally in the center of the clinic. Yes.
Well, it's just one of the many ways that patients can expect exceptional care. Where have you noticed exceptional care kind of personally in your own life here?
I think when I see the patients come out of the rooms and they're excited and they say, "Thank you for listening to me. Someone's really addressed and heard me as a person, and you've taken the time to hear me." That's what gets me excited.
And that's really the goal here, to hear and see people.
Yes, it's to make sure that all of our patients are seen, that we're addressing the needs that are most important and top of mind for them, and that they come away feeling as if they're part of our family.
What has been the most rewarding role for you to be a part of Centerwell?
Once again, I think it's just being able to support the team. It's being able to support the clinical team, the providers, the doctors, the nurse practitioner, and all of the hard work that they're doing by delivering exceptional care.
Explain how many patients you all see on average compared to a regular primary care physician's office.
Here at Centerwell Senior Primary Care, we're seeing on average about 12 patients a day. So that could be 12 each for the nurse practitioner and the physician. And that compares to about 20 to 25 in a traditional primary care setting. So we're able to have longer visits, so 45 minutes, up to 45 minutes for a lot of our visits with our patients, and that decreases the amount of patients we can see because we want to spend more time with them. We also have smaller panels, so our physicians will have panels that cap at 500, whereas with a traditional practice, a physician could have a panel of 2,000 to 3,000. So it's significantly different.
So back to this whole idea of this holistic approach. How does that actually happen here? How does that come out in form of services?
Every center has the ability to interact with our care integration team. That includes our social worker, our community health worker, behavioral health specialist, clinical pharmacist, and an RN, who actually help us as providers to support those social determinants of health that patients have. So whether it's helping us assist with transportation or Medicaid eligibility or other paperwork for utilities or housing, that team really supports us in being able to find those resources and then connect the patients to the resources.
We talk a lot about social determinants of health. How does that affect one's actual health?
Good question. So I'll give an example. If a patient lacks transportation, they may not be able to pick up their medications from the pharmacy. Thereby, whatever medication I may have ordered for them or one of the providers orders for them, they're not able to get it. And therefore, it could end up in an emergency room visit or even a hospital admission. So that's major. So being able to address that, helps us to overcome those obstacles and not let them be obstacles to healthcare.
Can it also come up in the form of loneliness? Can that affect one's bottom line health after all as well?
Absolutely, and that's where our behavioral health specialist helps us to be able to identify when people have social isolation, when they're depressed. And we have our activity center, our beautiful activity center, which every center has, to help address those. So we have certain days for bingo, we have days for movies, we have days for Tai Chi, where patients can come in and socialize with groups and with others to help address that isolation they may feel.
Which just kind of brought us back to that whole team. Why we're in here, you've got to have each of those members of the team to make it all happen.
I think healthcare these days, particularly as you get older, you need a team. you need a team, almost like you need a village. You need a team of people who care about you and who are willing to help address those needs. And they're not always going to be medical or directly medical.
Well, thank you for showing us around.
Thank you.
So to get started, just go to CenterwellPrimaryCare.com.